Welcome to Nutrition in Older Adults. Nutrition is an important factor in achieving and maintaining health and quality of life at any age. In this module, we will address some common issues in nutritional support for older adults. Nutrition has a significant impact on health and quality of life, as well as being essential for adequate energy and function. The purpose of this module is to discuss the impact of nutrition support on the well-being of older adults. The process of aging affects the ability of older adults to achieve adequate nutrition. Normal aging changes of diminished sense of smell, decrease in the sense of taste, compromised teeth and gums, decreased saliva, decreased stomach acid, lactose intolerance, decreased intestinal mobility, and constipation all affect the nutritional status of older adults. Older adults are at risk for malnutrition due to physiological, psychological, social, dietary, and environmental risk factors. And older adults are particularly at risk for not getting adequate nutrition or being malnourished. Older adults are more likely to have multiple chronic conditions that place them at risk for malnutrition. Older adults with food insecurity can lead to malnutrition and poor outcomes as well. Nearly 5.3 million adults over the age of 60 were found food insecure in 2018. That is 1 in 14 older adults. Malnutrition negatively affects quality of life, increases healthcare costs, and increases the risk of short-term mortality. So, what is malnutrition? There is no universal accepted definition of malnutrition in the health and scientific community. Basically, malnutrition is both too little or too much of nutrients or too many inadequate nutrient-rich foods. Malnutrition is the condition that develops when the body does not get the right amount of nutrients to maintain function and for staying healthy. Malnutrition may result from an inadequate or unbalanced diet, digestive difficulties, absorption problems, or other medical conditions. Healthcare teams may use various types of screening and assessment tools to identify and to develop a treatment plan to improve nutrition. As a caregiver, how do you recognize symptoms of malnutrition? The person may have excessive or prolonged sadness without a known reason. They might be feeling tired all the time or lack of energy, and this would be a change. You might observe new memory issues. They also might be getting sick more often and taking longer to recover. They could also be feeling weak and not able to participate as much as they could before in their daily activities. They can have bruised or cracked, dry skin, wounds that are slow to heal, trouble chewing or swallowing, loss of appetite or lack of interest in eating. We'd see an unintended weight loss, and their clothing or shoes might start being more loose. They also might have some muscle weakness. So, is malnutrition serious? Malnutrition is a serious condition. It's a significant threat to health, well-being, and a person's independence. Not getting the right amount of nutrients in the diet can complicate diseases. interfere with function, and prevent the body from adequately healing. So as a caregiver, what should you do? Prevention of malnutrition is the first step. Appropriate nutrition and physical activity are the fountain of youth and promote longevity and an active lifestyle. It is important to be aware of the signs of malnutrition and routinely look for indications. Become familiar with nutrition resources such as My Plate for older adults. My Plate is a visual comparison chart of a plate of food that highlights the color, amount, and foods that fit into a well-balanced diet for those over the age of 50. Healthy diets include fruits, vegetables, whole grains, protein, lean meats, poultry, eggs, bean and peas, nuts and seeds. When you suspect risk of malnutrition, keep a diary or journal of the individual foods and include water intake or any liquid intake. Keep a record for a few days on the type of foods consumed, the amount, what was the person's appetite, as well as the types and quantities of all fluids consumed during the day. This record can then be shared with your healthcare provider to provide them with a clearer picture on the person living with dementia's eating habits and hydration status. Search for aging resources such as Meals on Wheels in your local community or service centers. What about treatment and management? Well, enhancing food intake by allowing the person their preferences in food, allowing time for completing the meal, as well as encouraging the use of spices and herbs to improve taste, not so much salt and pepper. Eating is often social in nature, so eating together may increase intake and promote digestion. Prepare foods with appropriate consistency, with attention to color, texture, temperature, and arrangement on the plate. Provide smaller meals more often throughout the day if having a bigger meal is difficult for the person. Supplement meals with nutrient-rich liquids and nutrition bars. In severe cases, a healthcare professional may order a short course of an appetite stimulant to promote appetite and boost intake. However, this needs to be done with caution, as many of these type of medications have side effects that we don't want the person to experience. So the summary of this module is that nutrition impacts health, disease, well-being, and quality of life. Malnutrition is common in older adults. Prevention is the key to managing nutritional issues, and caregivers play an important role in preventing, recognizing, and treating malnutrition. Caregivers who want to know more about neuropsychiatric syndromes of dementia are encouraged to participate in the series. Thank you for coming. Have a good day.